Hey Fitheads, today we talk with Dr. Michael Mash. He's a doctor of physical therapy, the owner of Barbell Rehab, and he really focuses on helping clients deal with pain, whether it is because they're an athlete or perhaps they're in pain, and he uses the barbell to help get them out of pain. How freaking cool.
Not just the barbell. It started with just the barbell.
Right, that's
Now
true.
he now that's like that's the gateway drug to being obsessed with
Right.
exercise.
Kettlebells, weight training in general. And this is general population and older adults, even. It's not just meatheads like me and Max. He's talking to everyone, saying that the whole world should be lifting at least twice a week for infinity, that your whole life. How cool.
Strength training. It's a refreshing sort of, hey guys, let's focus on strength training. It's really, really important. And like
And he explains why.
and he's like, that's A, it's important. B, here's why. And C, it's important. Please understand that. Like he was so clear about it. Welcome to Total Fitheads.
Serious fitness for not so serious people.
Welcome, Dr. Michael. Can I call you that?
Of course.
Awesome.
Thank you. Thank you.
So glad to have you.
Thanks for having me on. I'm excited to see what we get into today.
Heck yeah. Can we first just get some background for the Fitheads about you?
Yeah, for sure. For sure. I'll give you the abridged version. So basically, I was a big time, loved baseball in high school. So my background is actually a high school baseball pitcher. And through that, I sustained a shoulder injury, as many baseball pitchers in high school did, and found weightlifting or strength training in general as a way to help both reduce pain and improve my fastball, my curveball, all of that. But in the process, I ended up falling in love more with training itself than baseball. So here we are about 10, 12, 15. Oh gosh. Anyway, here we are
Yeah.
about a decade later, where I am a doctor of physical therapy and I run a company called Barbell Rehab, where basically we teach fitness and rehab professionals how to better manage their clients who are dealing with pain. So we are all about getting more people training, because one of the biggest problems is not enough people are strength training. And I think one of the biggest reasons, other than lack of time, perceived lack of time, what have you, is people are banged up. And why would somebody want to work out if they already hurt? Right? Just so that's where I come into play. I empower fitness professionals and physical therapists to really help those folks. And I go around the country and teach a 2-day course all about that.
Love it. Yeah, it makes so much sense that people would think that they shouldn't be doing anything. If they're sitting in pain, they should stop versus starting, but it makes sense to me because Max and I have done it. But the person who's sitting, I mean, I'm thinking of my mom at this point, right? Where she's at home, getting older, having pain, but thinking that the answer is more rest versus what you're saying.
Yeah. And then you get caught in that down the rabbit hole, right? Where you just rest more and more, and then more pain and more pain. And I think one of the biggest reasons is it comes down to people thinking that the second they feel pain, they need to shut it down, or that pain equals damage. And if I'm experiencing pain during a workout, then that means that I can't work out at all. And it's far from the truth. We know that, I mean, physios and physical therapists, every single day, we are working out with people who are in pain during the workout. So it really comes down to navigating that situation of what types of pain are we okay with? Which types of pain do we want to shut it down? Because that's where the art and the science really comes into play with that.
Well, it's hard because you can't feel someone else's pain. Well, physically, emotionally, all the time. I feel everybody.
For sure. Yeah. And that's tough because pain is like unique to that individual, right?
Yeah.
So everybody's pain is a little bit different. And when somebody says, well, I'm having 8 out of 10 pain, what does that really mean? Right? One person's 8 out of 10 pain might be a little bit different than somebody else's. But I like to always think of that when somebody, like when we in physio school, we were taught that pain scale, right? On a scale 1 to 10, how much pain are you having? I like to think of it as if the higher the number that somebody tells me that they need help, right? If somebody is telling me 10 out of 10, that means that 10 out of 10 means that I want help. So I've kind of reframed that whole pain scale into like, okay, that tells me this person really wants to intervene here and we need to do something about it versus like the actual 10 out of 10 pain.
Which is
Yeah.
death, right?
Basically, right? We used to get people sitting like my first 4 years I spent in the clinic, right? So I was treating in a hospital, actually, in an outpatient setting where I was working with older individuals, deconditioned, things like total knee replacements. And sometimes people would sit there and you would ask them, well, on a scale of 1 to 10, how bad your pain? And they'd just be like 10 calmly, right? And so it's different. And we can't brush that off because if somebody says 10 out of 10 pain, right, then that tells me they need help. So that's where I'm getting at with this whole pain scale thing.
When you say types of pain, so it's not just a spectrum, right? Can you dive a little more into that?
Yeah, so for sure. A lot of times when we talk about pain, we have to kind of dive into what are they really trying to tell us? Like, because you and I, we all know what it feels like to work out and experience delayed onset muscle soreness. Like where the next day your muscles are sore, right? For
Sitting
somebody
in it now.
But if you've never worked out before, that might be 10 out of 10 pain to you, right? So we have to have that conversation where are you feeling muscle soreness? Or when patients and people start saying things like burning, stabbing, locking, buckling, radiating, like those are more down the, I like to call it like dirty pain spectrum, where we really want to, okay, let's pull back and figure out what's going on there. But when we hear things like dull, achy, soreness, when people describe and use lingo like that, that tells me that might be more on the spectrum of, okay, let's note that and let's keep moving forward cautiously and kind of monitor it. So that's what I like to tell fitness professionals who are like working with folks in pain, where you got to use the verbiage and the overall demeanor of the client to really guide you on do I push, continue with caution, or should I step back?
And is that a lot of programming when you're stepping back? And like, do you change from
yeah. So that's, you just opened up the can of worms there, because that's what it really comes down to. People get injured and people have pain because essentially it all boils down to they did too much, too fast, too soon after doing not enough for too long.
Yeah, that's what Allie does every day.
I mean, if you're okay with that and you just want to dance with pain forever, that's fine, right? That's fine, right? As long as you're still meeting your goals. But yeah, it's programming. And that's what we teach, because a lot of nagging aches and pains can be kind of controlled with making programming adjustments. And I always say there's this big push in the industry right now for the concept of exercise as medicine. And I'm totally on board with that. I'd love to see that, like, personal trainers are starting to get considered in the medical model as somebody, like, as a group of people that can really help maximize quality of life and allow people to engage meaningful in their life. But if we're going to start looking at exercise as medicine, we need to start being a little bit more cognizant of the dosage, like what kind of exercise, how much exercise. Because think about it, if a doctor prescribes some sort of medication for something and you have an adverse effect to that medication, what's the first thing they might do before scrapping the medication altogether? They're going to titrate and adjust the dosage. So that's what we need to look at when we're programming for folks. Do we need to scale back on the volume? Do we need to scale back on the intensity? Do we need to switch the exercise? Is there a certain exercise that's keeping somebody flared up? So for me, it's more often finding what they can do in the presence of pain versus perseverating and being upset about what they can't do.
Are there?
Yeah.
I mean, it's probably way too specific general to ask, but are there sort of worst offenders? The barbell bench. I mean, I'm thinking just bro exercises that we've always done and we always love, but you're sort of like, well, why do I Why do I do this? Because my buddy's older brother told me to do it in high school, and I never thought about it again.
Yeah, and I mean, people when people see our company name, Barbell Rehab, it's like people are like, "Wait, what? You're using barbells to do rehab? Like, what does the company name mean?" And to me, there's no such thing as a good and a bad exercise. Some people tolerate certain exercises better than others, but to me, there is nothing wrong with the bench press. There's nothing wrong with the deadlift. But if you've been sitting on the couch for a month and then you decide to go try and do a 1 rep max bench press, or you decide to try and do a 10 rep max or 5 sets of 10 to failure, now we're looking at an issue. And the issue wasn't the bench press itself. It was, what did you do? You made a dosage error. So I try to de-threaten these things that we hear of, like, oh, deadlifts will herniate your discs or bench press will tear your rotator cuff tear, because you know how many people have herniated discs and torn rotator cuff tears that don't exercise at all? So I'd like to say that there's no such thing as a bad exercise, only poor applications of them.
Is there a type of injury that you hear about the most, or the most common pain complaint?
I mean, yeah, so it's going to depend on like what type of population you're working with. But if we're talking like active individuals who go to the gym, the top 3 that I'd probably see would be hip pain, like in the front of your hip, mainly at the bottom of a squat. When I was routinely treating barbell athletes, that was like the number one thing I saw, like hip pinching and hip pain. And then 2 and 3 would probably be back pain with squats and deadlifts, and then shoulder pain with the bench press. But yeah, in all 3 of those things, we manage successfully more often than not conservatively. And piggybacking off of what we just talked about, a lot of it is controlled by making adjustments to people's programming and making adjustments to their form and how they're actually doing the lift.
And is it anything outside of the gym? I'm just thinking about the fact that I sit around so much, and you're talking about hip pain. Do you mostly focus on those adjustments with programming, or is it also lifestyle things that's harder to get people to comply?
Yeah, that's the tough part. So it's like a 2-part question. So if we step out of like active individuals, then I would say the number one thing would be back pain, low back pain. Because the fact is, like 80% of people at some point in their life are going to get low back pain. It is so common that we've actually coined it as like the common cold of the musculoskeletal system. So, I mean, it's pretty normal to get like a cold a couple times a year. So if to me, if somebody has 1 or 2 episodes of low back pain a year, that's also like within normal limits of just being a human. So the management of it has really, really changed from treating it as a medical issue to really treating the whole person holistically. And that's where we can really get into like, what are all the factors that can cause pain? We used to think it was just, oh, if I have back pain, there was something physically wrong with my back, physically damaged, and it needed to be fixed. Then with the emergence of the concept of pain science, which is basically the study of pain, what are all the different factors that can affect pain? That's where we get to lifestyle things. And we see things like stress, anxiety, depression, sedentary behaviors, fear of movement. All of those things can certainly affect a pain experience. And that's why me as a physio, and I teach personal trainers this too, that you can't just zone in on the one tiny muscle in their back that you think is not firing correctly. Because if they're only sleeping an hour a night and they're not hydrating and they're not eating well, then nothing's going to touch it, right? Because we have to treat that person as a whole. And I think that's where my profession, we're starting to get better, but we used to just zone in on this person's back hurts. What's wrong with their back? Meanwhile, they're like overworked, overstressed, poor nutrition, and you can only do so much. So we have to treat the person as a whole for sure.
Yeah. And so I guess we talked about people that are already athletes then working around an injury, but are you saying that someone who is injured could then use the barbell to mitigate that pain when they hadn't done it before, when they've not used, any sort of lifting as a technique?
Yeah. So, I mean, when I started this company 6, 7 years ago, I was dead set on like every single walking human being on the planet should do a squat, bench press, and deadlift with a barbell. And that's where the whole name Barbell Rehab came from. I've since migrated from that because I know. What's most important is that people are physically active by any means, right? Whether that's a barbell, a kettlebell, body weight exercises, dare I say machines. I mean, the biggest thing is, how do we get people to at least strength train twice a week for their entire life? Like, that should be the number one overall goal, is how do we get people to strength train at least twice a week for their entire life? And it doesn't necessarily need to be a barbell at first, but it certainly can be. Maybe it's like a squat to a chair with a stick on your back, right? Or a training bar that's 15 kilos, or they make barbells that are 15 pounds. So I wouldn't get so caught up on the way we're loading people. It's just, let's start with something that's available that they can adhere to, that's light, and build from there, whether that's a light barbell, a kettlebell. I'm a lot more liberal with that now than I was when I started the company, because I saw the bigger picture. And the bigger picture is this: only 23% of people in America are meeting physical activity guidelines. And that's what we really need to focus on. And we need to hit it from all angles.
Is there a cardio aspect to your targeting too, or is it 2 times a week and it's lifting? And let's not think about my blood pumping or whatever. I'm breathing heavy.
So absolutely. So what we teach, we are very specialized. So we are far down the strength training rabbit hole. So we don't cover cardio as a company, but it is 1000% recommended. So part of that recommendation, which is essentially World Health Organization recommendations, is it's 2-part. So 2 times a week strength training minimum, plus 150 minutes of moderate intensity cardio a week, which sounds daunting, right? 150 minutes, like how can people get that in? And the trick here is this: little movement snacks. So the 150 minutes doesn't always have to be 20, 30, 40-minute sessions. It's these small things that you can say, hey, next time you want to take the elevator, maybe take the stairs, right?
Love that.
So all of that adds up. So however you can try and encourage people to get towards that 150 a week, take the long way, like walk more, stairs more, anything that you can do. And that's going to help from just globally health. So yeah, that's what we're looking at: 150 minutes a week and plus 2 times a week strength training.
Yeah, I was just gonna say get a dog.
Yeah.
But that's more for life.
But that helps with pain too. That can help with pain too, because maybe that's calming for somebody. Maybe that's a de-stressor. Maybe that helps just make people have a more positive outlook and feel more fulfilled in general, which 1000% can reduce somebody's pain.
Worked for me. You said strength train twice a week forever. Are you pitching?
Oh, yeah.
So we're gonna live forever?
How do you convince? Well, first of all, yeah, how do you live forever? And second of all, are you having a tough time, or are you focusing on convincing seniors? Seniors meaning over, I don't know, 35. Yeah. I don't, whatever you want to define seniors as.
So, I mean, when I say forever, I mean across the lifespan, right? For as long as somebody can possibly do it. And unfortunately, if we look at older adults, which we'll classify as 65 and older, because that is like the book term for older adults, 65 and older. Unfortunately, a lot of them realize it once they start having trouble during their everyday life. So I assume at some point in your life, have you done a 1 rep max squat? I assume you know what it feels like to do a 1 rep max squat, right?
This morning.
Sucks.
No.
This morning, what are you doing?
No. So you know how hard that was, right? You know how much physically taxing that was. Can you imagine if you had to put that much effort into just standing up from a chair one time? And then do that multiple times a day. And that is the reality for a lot of our older adults. They're so deconditioned, and that they're essentially doing 1 rep max squats all day just to stand up from the toilet, from a chair, from a couch. And that's why like strength training for me is the fountain of youth, because if we can find a way to have somebody squat for their entire life. Now, it doesn't have to be a heavy barbell back squat, but if we can find some way to have somebody do a squat, whether that's holding on to their kitchen sink and squatting, whether that's sitting down and standing up from a chair with them folding their arms across their chest. When I was in the clinic, if somebody had any kind of pain that was like from the chest or below, they were getting squats, because I think it's that important to maintain quality of life and to maximize it into our later years. So as far as getting the buy-in, people don't exercise just because they want to exercise. People exercise for a bigger reason. And the bigger reason is they are doing it because they want to improve something that brings them joy in their life. So if coaches can really tap into that, like to what makes people tick, like we don't want to prescribe a deadlift, just say, hey, we're going to do deadlifts. We want to find out, are you having trouble picking your grandkid up off the floor? Or like things like that. That is what'll get the adherence. And that's what's going to make people want to strength train.
Maybe we need to rename deadlifts into child lifts. Loved one lifts. You know what I mean?
I mean, when it really comes down to it, I mean, like, what do we do in our everyday life? Like, we're pushing doors open, we're pulling, we're reaching up overhead into cabinets, we're squatting down, we're bending down, we're picking things up off the floor. So
jumping on the kitchen table.
I mean, you never know when you're going to need to do that, right?
Grocery carry, that's the best one.
Yeah, 100%. Farmers walks, like these are all things that we do in everyday life. And there's no better way to go through life and have those things be a little bit easier for us than to train it. Okay. I mean, that's what it really comes down to. And I've had hundreds and hundreds of people over the age of 70 successfully doing squats and deadlifts. Was I loading Granny up with a 315-pound barbell back squat on day one? I mean, I'd love to, but most of the time, no. But these exercises can be scaled, right? Here's a 10-pound kettlebell. I want you to sit down on that chair and stand up 10 times, right? And then if somebody gets really good at that, then suddenly standing up from a chair one time is a walk in the park.
Right.
Yeah. I mean, while we mention it, how often, if ever, should anyone do a 1 rep max?
It's a good
Can I do
question.
it again today?
For sure. Just keep going and just see how push the luck, right?
It's luck.
Just luck of the draw. Just grip and rip, baby, and hope for the best. I don't think anybody really, unless you're competing for a powerlifting competition or training for it, I don't think a 1 rep max is necessary for the general population in order to see improvements in strength and hypertrophy. Because we got to come back to like, why is the general population exercising and strength training? And it's to reduce risk of some of these nastier things later in life, like sarcopenia, which is like muscle loss, osteopenia, osteoporosis, diabetes, cardiovascular disease. I mean, we have a plethora of evidence that shows that strength training is like one of the biggest things that you can do in combination with cardio to reduce risk of these things. And so that's like the bigger picture here is we're trying to set people up to be as healthy as they can for their whole life. And 1 rep max training isn't necessarily part of that. The only time that I really would start to push that is if somebody's like has a goal for it, or they want to test the waters and see, then I'm okay with it. But if you ask me the question, is it necessary? Then I would say no.
Okay, not necessarily 1 rep maxes, but this is a 2-part question.
Okay.
When should I stop chasing PRs? And after that moment, what am I supposed to care about? Gains are just so much more fun than maintains. Like, what do you have people in older age focus on to improve?
Yeah, so I think people's goals change across the lifespan. Right. When I was in my late teens, early 20s, it was all just like, what's the 1 rep max? Like, how much can I deadlift? How much can I squat? How much can I bench press? And some people maintain those goals throughout their entire life. Like we see professional powerlifters who are competing into their 50s, 60s, and 70s. And guess what? That's still your goal because that's your sport. So if your sport's powerlifting, then there's no reason you can't train to perform 1 rep maxes forever. Now, I mean, the older you get, the 1 rep max isn't going to be as heavy as it was maybe in your 30s and 40s and 50s, but it's still a 1 rep max for you at that time. So I think you just have to always come back to what are your goals? What do you want to get out of strength training? What do you want to get out of the gym? Do you want to get stronger? Well, then we should probably train low rep to be able to do that with the barbells. Do you want to get quicker? Well, then we should probably train power. Do you want to get bigger? Well, then we should probably train for hypertrophy where we're getting more volume in. So I just think it comes down to like as long as people are training at least twice a week, like that is the overarching goal. Then like the next thing is what style kind of makes the person tick. And that's what we should really stick with. So for me, for example, like when I was in my late teens, early 20s, it was just like, I was obsessed with 1 rep maxes. Like that's what I wanted to do. Now I'm like, okay, I don't want to get out of breath when I walk up 3 flights of stairs. So I still train heavy. Like I just did a floor press today for a 2 rep max. And it was like, yeah, that felt good. But I'm doing things like rotation based work, higher rep work, cardio. So because I want to feel good and I want to be a well-rounded human that's capable of expressing different levels of fitness across multiple aspects of being a human in general, right?
Yeah, I guess in a similar vein to the 1 rep max, like training to failure, how close should we be getting? How often question. Should I be getting close?
Yeah, so that's a great question. And it's actually one of the biggest parts of our course where when somebody has pain, basically we have like a 4-step framework to look at. Let's say, okay, I have knee pain in the gym. What do I do? There's just like such a broad question. And more often than not, people go down like the warm up in the recovery tool rabbit hole. They're like, all right, I need more foam rolling. I need more stretching. I need more mobility work. I need to do those 5 exercises that I saw on Instagram to fix my knee or fix my back, which I'm not knocking on that. Like sometimes they work, but dancing with failure. I mean,
they were on Instagram, so
it must work, right? Dancing with failure is tough. So the way I like to use it is the RPE scale. So basically somebody does an exercise. Let's say they do a set of 5 of squats. Then you ask them on a scale 1 to 10, how difficult was that? Right? A 10 out of 10, meaning it was the most difficult thing they've ever done in their life. And it was a rep max. And if you ask them to do another rep, no way. It was like as much as they could. 9 out of 10 means that was pretty freaking hard. But if you asked me to squeak out 1 more rep, I could have. And then so on and so forth. Like RPE 8, that was hard, but I could have done 2 reps. RPE 7, difficult, but I could have done 3 more reps. And now is where we get to the sweet spot. So I like to say the majority of your compound heavy lifts, like squats, deadlifts, bench presses, dumbbell bench, like anything that's heavy multi-joint compound lifts, should be done in the RPE 7 to 8.5 range, meaning that you should be leaving 1 to 2 reps in the tank for the majority of your big basic lifts. So we start to dance towards failure, but not necessarily taking it to failure. And more often than not, when somebody's having pain in the gym, 5-6 years ago, I was obsessed with form. I was like, all right, what do I need to fix about their form that's causing their pain? And now I've gotten away from that. And one of the biggest questions I've asked was, tell me a little bit about your programming. How many of your deadlifts, squats, bench presses are you taking to failure? Because it should really be not that many. And if we even look into the field of powerlifting, powerlifters aren't taking their squats, benches, and deadlifts to failure every session either. They are training in a way where I am sticking right at that RPE 8.5 sweet spot, training there to both build strength, build hypertrophy, and then they are doing the 1 rep max on the platform to express all of that strength that they gained while training in that RPE 8 range. So that's the sweet spot. And that's one of the biggest things about our course is if somebody has knee pain during squats, but they're doing 5 sets of 10 to failure or 1 rep maxes, literally nothing's going to touch that. As far as you can do all the foam rolling, mobility work, form optimization you want, but that is a programming error that we need to fix first. 100%.
Nice.
Dancing with failure is my entire brand. Okay.
Dancing with it. Love it.
Yeah. So then if you're doing this 8 RPE, recovery is easier, right? Is that a part of it where you're going to bounce back better? Is it diminishing gains between when you get to 10, like your recovery is going to suck significantly more than if you just held back? Or am I reading into it?
No, that's exactly what we're talking about. I mean, I like to say if all you're doing is 1 rep maxes, then you're essentially just testing, not training. You're just testing your strength all of the time. Because the RPE 8, when you train there, you're going to be able to do more sets. Because let's say you are doing a squat and you're training somewhere in like the 4 to 6 rep range. And every set, you're using the same weight, and every set you're taking to failure. Actually, pull-ups is a better example. Let's say that like you do pull-ups and every set you take to failure. At first, the first set you may be able to do 8. Then the next set you're doing 6. Then the third set you're down to like 3 because you're taking every set to failure. And by the end, like you're completely gassed out. Instead, if we were doing 5 sets of pull-ups at RPE 8, over those 5 sets, you're going to be able to do more reps than if you took every set to failure. And what we know about strength and hypertrophy adaptations is a lot of it comes down to the volume. So you're going to be able to get more high quality volume in if you're consistently training at RPE 8 versus just taking every set to failure where you're doing less reps and overall. So that's where it really comes down to. That's where the magic is. Training. So this is not an excuse not to train hard, by the way, because RPE 8 on a squat's pretty difficult. Yeah. So, and we see people still get just as good strength gains and hypertrophy gains, kind of pushing and dancing towards failure, but not necessarily training at failure. So that is the number one thing when I do online consults with like lifters in pain. I'm like, how much you train in failure? And oftentimes just fixing that without me ever laying a hand on them is what's needed to control the pain. And still, they'll still progress too.
Well, it sounds like it also a good strategy to to prevent injury, right? So are there other things that we should be doing if we're not in an injured state to maybe stop that from happening?
So like preventing injury, basically, like anything else we should, that I would be extremely rich if I had that answer. So like
other than prayer, obviously.
Yes. The verbiage I always like to use is there's nothing we can do to prevent injury, right? It always comes down to risk reduction. There are strategies that we can do to reduce risk of injury. And we have to, and that kind of goes back to how we started this conversation. Yeah, it's multifactorial and we have to hit it from a bunch of angles. The best way that I like to teach this is the coffee cup analogy. Can I share that with you?
Please.
Yes, please.
All right. So let's say you have a cup of coffee and inside you actually have the coffee, and the coffee represents all of the things that could contribute to pain and injury. So when we look at that, we see things like anxiety, stress, depression, doing things with people doing fun things with people we enjoy, like socially, fear of movement, like not being afraid to move different ways, load management. So we have to hit this from all angles. And when we make too many mistakes, or when all of these things kind of bubble up and you get too much coffee and it overflows, that's when you have pain. So it really comes down to how do we reduce the amount of coffee in the cup, and how do we build a bigger cup? Because that's what's going to make people robust and pretty resilient to injuries and reduce the risk as much as we possibly can. So building a bigger cup is pretty simple. It's let's strength train intelligently. Let's train a bunch of different lifts, variety, RPE 8, not doing too much too fast too soon. And let's get aerobically fit. So that's going to build a nice big cup to help people kind of reduce the risk of that coffee overflowing. And now the other part is, how do we reduce the amount of coffee in the cup? Like, this is the only time where it's not good to have too much coffee. So we want less coffee in this scenario. So how do we do that? Well, how do we manage anxiety, stress, and depression, right? So we do things like mindfulness, meditation.
1 rep maxes.
I mean, 1 rep maxes maybe can help reduce coffee in the cup from a stance of, that makes me feel good, right? That brings me joy to do that. But from a mechanical standpoint, too many 1 rep maxes, right? But I mean, this is why we just can't say like, oh, foam roll and you'll fix your pain. I mean, it's not going to do anything if you're a big ball of stress and you are feeling socially isolated and you're afraid to move. So I always like to say, let's get people moving. Let's get them to trust their bodies. Let's make sure stress management techniques are the best they can be, whether that's meditation, mindfulness, medication in certain scenarios, right? Diet, exercise, making sure we're eating well, drinking well. That is going to be, there is no one thing that we can do to prevent injury. It has to be hit from all angles.
Great. Thank you. I was going to think orange juice, but whatever. It's fine. You've touched on it a couple times, but you certainly haven't. It doesn't sound like it's a priority. Dare I ask about mobility?
Ooh, so mobility, that's a thing, and I get some slack on social media. They're like, why don't you ever post mobility stuff? Because if you go through my page, there's not much on mobility. Because there's
one post where you said you don't need it.
Hey, don't take it out of context.
It's a good hook.
Yeah, for sure. Like that'll be like the 10-second TikTok clip that you take. Barbell Rehab says you don't need mobility. Here's the deal. You need enough mobility to do the things that you enjoy in life. And that's going to be different for everybody. So I was trained on a model that where when I assess somebody, I would look head to toe at all of their mobility impairments. And if they had any mobility impairments anywhere, I would fix them. Like that would be number one. Like, oh, you lack ankle dorsiflexion. Let's fix it. I've now switched to, if somebody has enough mobility to do the things they enjoy, then we probably don't need to do a heavy focus on it, because it's not mobility training that's going to ward off those nastier things later in life. It's going to be loading tissues over a prolonged period of time, plus aerobic work that's going to reduce risk of cardiovascular disease, diabetes, osteoporosis, all of that. But mobility is a part of that, because if you don't have enough mobility to do the things you enjoy and to effectively strength train, then that is going to be the limiting factor. So I think it's important, but what I don't want to see is somebody on a 1-year-long mobility program and not strength training and not doing cardio. It's one of those things where you need enough to do the things you enjoy, but it shouldn't be a substitute for strength training. And a lot of the folks that'll come into physio's office or a personal trainer, they might not have great mobility, but guess what? You can still strength train within that mobility that they currently have. Like, let's say somebody doesn't have enough mobility to do an overhead press, but they can still landmine press to their current mobility. And then we're going to simultaneously work on that mobility. So we are hitting this from all angles, and mobility is certainly important, but it shouldn't come at the cost of replacing strength work. And you want to know one of the best ways to improve mobility is to actually start to load it a little bit. Like, one of my favorite ways to improve hamstrings flexibility is a slow tempo RDL, like Romanian deadlift. Or one of the best ways to improve shoulder mobility is a slow tempo light lat pull down, where you let the lat pull down kind of pull you up, stretch your shoulders out. So now it's like a two birds with one stone. He's going to do this
every day.
Those are my top two, so thank you.
RDLs and lat pull downs. There you go.
No. Now hamstrings and shoulder, my shoulders are terrible. My hamstrings are terrible. I've never been flexible my whole life, and I've stretched a ton, and I just haven't really. never happened.
Probably never sticks, right? You just get that like temporary increase, and then next day you wake up and you're like, shit, back to square one. But
Pathetic.
yeah, slowly loading into that can be one of the best ways to really help solidify that. And you're getting the benefits of strength training. And in a world where people are leading really, really busy lives, if I can have one exercise that improves mobility and strength at the same time, hell, I'm doing it all the time, right?
Yeah, I'm surprised. Like you're saying, squat, bench, deadlift. I thought this podcast would be me getting shamed for doing so much bilateral stuff, and then us just hearing how much that we should be doing unilateral at it is, or I guess it's not what I expected. Or what are your thoughts on that?
Yeah, I mean, I that's the tough thing, and that's why we created a certification course, because social media only tells like part of the picture, right? You can only explain so much in a reel or in the caption on Instagram or on TikTok. YouTube's better for that, but it's more or less like this debate of, oh, what's better, a squat or a lunge? Like there doesn't need to be a debate. They're both good exercises. Do both, right? So like do a well-rounded program where there are bilateral lifts that you can push for strength, where there are unilateral lifts where you're going to get more sports performance transfer over to life, and being able to train balance. So it's not like one is better than the other. It's a do both. Like a good, well-rounded lower body program should have some sort of squat variation, some sort of bilateral hinge variation, some sort of lunge, some sort of single leg hinge, and then some sort of balance and power. Like we should be doing it all, really.
And cardio. Ugh. Deadlifts aren't cardio, right? Can we just confirm?
I mean, it's going to get your heart rate up, right? For sure.
Okay. Is there anything else that, because I had, muscle building and then cardio for longevity, is there another missing puzzle piece, or is it really just focus on those and that's the goal?
So I think if we're strength training, progressive overload, and then we're also doing some low intensity cardio, because there's just going to be some benefits that you get from like low intensity zone 2 cardio that you can't really get with strength training. So there should be some low level cardio, some high level strength training. Balance is also important, especially for our older adults, like for risk reduction for falls. It certainly takes some balance to squat down and stand up with a heavy barbell on your back, but getting people into like a single leg position where they are feeling wobbly, that's really good. And power's good too, because getting people springy, like I want to see people feeling like they can jump. And basically, if a human is capable of doing it, we should probably be training it in some sort. So I think if you add power and balance to your strength in cardio, which you just told me, now we get more of the well-rounded program we're looking for.
Just text my mom about her starting handstand walks.
There you go. Just right off the bat.
Humans can do it. She should be training it. I'm just kidding. I get it. So wait, zone 2, that's not walking. That's a little bit harder than walking, right? Or significantly harder.
Yeah, a little bit. A little bit harder. I can't get too far down the rabbit hole in that one because it's a little bit outside of my expertise. I'm more of a barbell strength guy, but I do plenty of zone 2 cardio. And for me, that is just like doing things for prolonged periods of time, right around, it's going to be a little bit different for everybody. So hopefully audience doesn't take this out of context, but it's going to be somewhere around like 110 to 150 beats per minute. It's enough. The basic test is you should be able to still hold a conversation with somebody and not get gassed out. So that's where get on the treadmill, get on something where you're able to do it for 30 to 60 minutes and push it to an intensity where you can still hold a conversation and you're not out of breath. So that's basically what zone 2 cardio is. And you're going to get the cardiovascular and the heart adaptations from that you may not necessarily get from strength training.
What about these?
And it's like
air quotes, high intensity interval trainings, the classes, the Barrys and the F45s and all that stuff.
Yeah. I mean,
is that just for show?
No. I mean, you're still going to get pretty good cardiovascular adaptations with that. And you're going to get fat loss with that. So, I mean, the big picture is anything that gets people moving is better than sitting on the couch, right? That's what it all comes down to. And I used to be the guy that made fun of Planet Fitness, right? Oh, like, are they? And now I'm like, hey, look, these people are at least doing something, right? And it's better than sitting on the couch. So HIIT is great for fat loss. It's great for cardiovascular adaptations. The cardiovascular adaptations are going to be a little bit different than what you would get with the slow, steady state. But 100%, there's still a time and place for them. It just shouldn't be done. It shouldn't be the only form of cardio somebody does. There should still be some low intensity in there too.
I've heard the best exercise is the one you're not doing. So that aligns with what you're saying. Do it all. Yeah.
Yeah. And that, I mean, that can be overwhelming for a lot of people, because if somebody can't adhere to something, right? Because remember from the beginning of this episode, what's the number one thing? How do we get somebody to adhere to exercise across the lifespan? And if we just throw all of this stuff at somebody from day one, like, I get a new client, all right, we're going to do cardio, we're going to do jumping, we're going to do strength training, like, that's one way to make sure somebody like doesn't come back. So I like to sprinkle these, because I mean, coaches and clinicians, when it really comes down to it, we're in the game of behavioral change. Like, how do we get people to adhere to exercise for their entire life? And it comes down to like a stepwise approach, not thrown so much at everybody on day one. So for me, it's just like, all right, what is the biggest bang for your buck things that I can do with a new person that's going to give them the most health benefits? And for me, that comes down to things like sit to stands. Like, your ability to sit down and stand up from a chair carries over to so many things. You push that for higher reps, you're going to get cardio. You're going to get function, because now you can move around your daily life a little bit better. You're going to get quad strength. You're going to get glute strength. You're going to get hamstring strength. And then hopefully people like catch the exercise bug and they start to enjoy it. And then you can start sprinkling things in, like, all right, let's start doing some power exercises. Let's start doing some cardio. So baby steps for the adherence, so that you just don't wig people out with do all this, right?
And then you've created a monster and you got to pull them back from 10 RPE. It's great.
Basically, right? But I mean, if it really comes down to it, 80% of people have low back pain, whether they lift or not. So whether you sit on the couch or whether you're doing 1-rep maxes, most likely you're going to have back pain at some point in your life. So I'd rather be strong and have back pain than be weak and have back pain, right?
Love it.
So it's the risk that I'm worth taking. It's a risk that's worth taking for me every day. The risk of potentially getting injured in the weight room, because we know that there's even more risks from not lifting. So that's what it really comes down to.
And I think I know your answer to this, but I did want to bring it up. Thoughts on TENS or like the power dot, that kind of thing for pain management, or cupping, all of these kind of trendy stuff. Yeah. Is that a part of your regimen?
Usually not. And here's why. All of these things work. So if there's anybody out there that does cupping or uses these products, they all work. I'm not denying that. But the reason they work is more or less because we're making like quick changes to the nervous system to calm it down. And the problem is, though, people often find themselves needing more and more of it just to get the same desired effect. And this is like what I call the foam roller trap, where when you first start foam rolling, you're like, oh yeah, this feels good. Like, this is decreasing my tightness or whatever. And then the next thing you know, you need to do it longer. And then you need to do it more times during the day. And then the next thing you know, like, you need to be on a TENS unit 24/7 just to feel good, right? So the way I like to look at these things are, I'm for them if they help people get these quick changes in pain to allow them to then exercise more effectively. But as the sole way to like fix somebody's pain, it often doesn't end well, because then it ends up being compulsive, needing more and more and more of it. And next thing you know, people aren't exercising and all they are doing is the TENS unit. So we have to find that happy medium between allowing people to use these things to get that quick change, but making sure it doesn't become compulsive and replace exercise. But yeah, they all work. They all work.
As a method to be able to get to exercise, that should be the goal.
Exactly. Okay. And a lot of the consults that I do for people that have chronic pain, a lot of times it comes down to having to wean them off of it because they've already gone. They're like, I foam roll and I stretch 5 times a day and I still don't feel good. And it's the fallacy that things that provide temporary relief, doing them more often is usually not the answer for permanent relief. It's usually just like chasing the carrot, right? It's just, but a lot of people, by the time they realize it, they're already. So we have to use like a lot of mindfulness techniques to try and wean them off of it. And then trying to figure out go back to our coffee cup analogy, what other things in their life is making their coffee cup overflow? Is there stress, anxiety, depression? Is there poor coping mechanisms to those 3 things? Is there fear of movement? Are they socially isolated? Are they not doing enough things with the people, like fun things with the people that they enjoy doing them with? And that's why we need to really look at this holistically instead of just saying you need to do one more session of foam rolling.
It's always the next one that's going to help.
Yeah,
I know, right?
That's the one that's going to solve everything.
Yeah, we can look at anything like spinal manipulation too. It's just like, I just need that one adjustment that's going to finally fix me, right? Or I just need that one massage that's finally going to fix this. And more often than not, it's like, have you ever seen the meme where like there's like this big giant tub of water and like water's gushing out of it, and then you just like try and slap duct tape on it? Like those are like that's the analogy I like to use of all of these things trying to fix an overflowing coffee cup, which needs to be fixed by multiple avenues, not just a piece of like K-tape, right?
Yeah. We haven't really talked about nutrition.
Well, because it's one of those things is like, I can only do so much as a company. So I kind of, I'm like the exercise guy. Like our course is like, how do you help people strength train pain-free? And I've gotten asked that question. This is like, why don't you cover nutrition? Do you not believe in nutrition? Well, of course I believe in nutrition. It's just not my wheelhouse. So I'm not the guy to really have that conversation, but just know that it certainly matters. Is if you're not drinking enough, if you're not eating the right amount of food, like the right kinds of food and the right amounts of food, then everything else kind of goes out the window. But I'm just not the guy to cover that, really.
Well, speaking of overflowing cup, Max, you want to ask the one question?
Oh yeah, it sort of leads into what we nutrition. How do you help your clients manage their alcohol?
So for me, that's not something that I've really worked with because right now I'm in the sector of continuing education. So we're basically teaching the fitness professionals how to work with the people. But when we look at it, it really just comes down to anything like healthy relationships with things, like completely cutting things out and telling people they can't do things usually backfires. So I think right? It just like leads to compulsive behaviors. So I think that if we just stick to recommended guidelines, and don't quote me on this, but it's just like something like 7 drinks a week or less, right? Having healthy relationships with things that we know are not necessarily good for us. And this could go to anything that is not necessarily good for us. Having a healthy relationship with it, not necessarily going cold turkey, right? Cold turkey works well for some people, right? So if there's people out there listening that went cold turkey and it worked for you, like kudos, like I'm super happy for you. But more often than not, it just comes down to having a healthier relationship, getting it back down into levels that aren't going to necessarily impair recovery. So to my knowledge, the latest recommendation was no more than 7 drinks a week, and not like 7 drinks in one day either, right? It's just no
1 power hour a week.
There you go. Done. Back to the college days, baby. Yeah. So
all right, solid.
And just overall, like
yeah.
Just loving yourself.
I really appreciate
right?
you chatting with us. Yeah. Loving yourself. That's 7 loving yourselves a week.
Minimum.
There you go.
Maximum. Wait a minute.
So where can the fitheads find more about you and Barbell Rehab?
Yeah. So barbellrehab.com. There's a lot of free articles on there that teach you how to work around pain. And the biggest social media platform we're on right now is Instagram. You can conveniently find me at Barbell Rehab on Instagram as well. So those will be a big 2 places. TikTok, I'm still deciding what I want to do with that platform, but we'll see where that goes.
Can't wait.
Awesome. Thank you so much. I'm convinced that we've convinced my mom to start back squatting, so I'm pleased.
I've done my job. Thanks for having me on.
Yeah, thank you again. And thanks to the fit heads. If you can rate and review on Apple Podcasts, that helps us out a whole lot. And we'll see you next week.